Okay.
Okay, we assessed Katie's vital signs outside. We did a blood pressure with her lying down, which was 106/70. Then we did a blood pressure with her sitting up, which was 108/72. And then we did a blood pressure standing up, which was 104/70. And what we're watching for is a drop in her blood pressure to see if her heart is keeping up with the change of positions. Temperature, all her vital signs were within normal limits. Temperature 97.6. Her respirations were 16. Asked if she had any pain or discomfort this morning. She said no. O2 is 99% on room air. And then we did the Snellen chart out front with her vision, which was 20/20 in both eyes. And with both eyes open, it was 20/20 also. Katie is 5'2", weighs 160 pounds, and with a BMI of 29.1. So we'll discuss kind of a diet like fresh fruits and vegetables, low saturated fats, kind of discuss foods to eat more often other than fast food. We did a waist to hip ratio, which was 0.76. And now we're going to go ahead and start with a head to toe assessment. Okay. I'm just going to kind of feel around on her head, noting any nodules, any pain.
No.
Can I palpate your head? Okay, hair is well distributed, head is symmetrical. And she says she has no pain on palpation. Hair is dry, she has no debris noted. So then we're going to move on and kind of start palpating the face. And if they have glasses, you can have them take it off so it's easier to palpate. Any tenderness?
No.
Okay, first we're going to start with the eyes. Let's see. I'm going to have you stare at my nose, and I'm just going to run a light across your eyes and watch for your pupils to react. Good. And you're watching for their pupils to constrict, which both her pupils are active. We'll pull down, kind of look at her ducts, make sure they're pink, moist, nothing down in her ducts. Look at her eyelashes, make sure there's no debris. It's good. Going to press on your lacrimal punctum. During this pressure, you'll see if any drainage or pus comes out of her eyes. Now I'm going to have her follow my pin, moving your eyes only and not your head. This is assessing her eye movement, which is also one of your cranial nerves. Good. Now I'm going to have you stare at my pen, and then I'm going to have you find a spot on the wall. So go for my pen, spot on the wall, pen, spot on the wall. Okay. Any trouble?
No.
Any pain moving your eyes? Okay. And her eyes moved accordingly to my pen, so eye movement is good. Going to kind of feel around on the sinuses, ask them if they have any tenderness, they don't feel swollen. Okay, and now we're going to go ahead and move to her nose. You're going to assess the bridge of her nose, ask if there's any tenderness, feel around, make sure her nose is symmetrical with her face, hair evenly distributed. You're going to take the otoscope, and pretend this is the otoscope, look inside the nares. Make sure there's no obstruction. And then you're going to assess for a deviated septum, which could cause obstruction and hard to breathe. I'm going to have you close one nair and breathe out. And do it the same on the other side. Any difficulty?
No.
Okay. And we're going to go ahead and move to your mouth, and then we'll do your ears next.
Okay.
So you're going to kind of look at the all-over color, note dryness to the lips. So her lips are pink, dry. I'm going to have you pull your lip down for me. Just kind of take an inside look at the inside of her mouth. Just make sure she didn't have any sores in the top. Okay, good. And now I'm going to have you stick your tongue out and say ah. And you're going to look for the uvula, make sure it's symmetrical. And Katie doesn't have tonsils, so you're not going to see any tonsils back there. We're going to take a look at the soft and hard palate, so lift up your tongue for me. Just make sure there's no lesions, sores, any trouble with sores in your mouth. Okay. And Katie has all of her teeth. All your normal teeth, no artificial teeth. Okay. And now we're going to take a look at your ears. You're going to just look at the outside of your ears, the auricle, make sure there's no lesions, tags, debris. Make sure hair is evenly distributed within the ear canal. Adequate amount of cerumen, no discharge coming from her ears. Okay. And we're going to take the otoscope and take a look inside of her ears, pulling the ear up and out. And you're going to look inside the ear and assess the eardrum. And you're looking to make sure the eardrum is gray, moist, Watch for inflammation, redness. Have you had any trouble with drainage or anything in your ears?
No.
Okay. So everything looks good inside of her ears. Next we're going to move down to the neck. Going to kind of feel for her lymph nodes. Going to start with the occipital lymph nodes first. Just noting any swelling, tenderness.
No.
Okay. Then you're going to go for your post-auricle, pre-auricle. And some people, they're not always going to be in the same place, so you just kind of have to feel around. Okay. Anterior cervical. And our posterior cervical. And then to check the clavicular, you're going to have them kind of shrug. Any tenderness?
No.
Okay, we're going to go ahead and I'm going to assess her temporal pulses. Go ahead and do those. So you're just assessing to make sure you can feel them on both sides, in which they're present and bounding. Then you're going to take the bell of your stethoscope and just kind of listen to the temporals for a bruit. Okay, so temporals are good, no bruise present. So we're going to go ahead and palpate her carotids and do one at a time, because doing both you could cause a syncopal episode. Good. Okay, and you're going to kind of do the same thing with the carotid as you did with the temporals, and go ahead and listen with the bell of your stethoscope to assess for bruise. Okay, so everything looks good. Now we're going to move on to the chest and do heart and lung sounds. So first we're going to start with the lungs. You're going to listen anterior and posterior. And as soon as I place my stethoscope, I'm going to tell you to take a deep breath, and I'll just have you repeat it a few times. Deep breath. And noting chest symmetrical when she's breathing. And you can be inspecting all over skin, making sure it's pink, warm, no lesions. Any difficulty when taking breath?
No.
Okay. And you're going to deal with this posterior too. Noting all of her color and looking at her skin. And when you're listening, you're just assuring that she's having air exchange and no extra sounds. Okay, so lung sounds are clear in all lobes, posterior and anterior. I'll go ahead and do respiratory excursion. You just place your hands on the back of her back and have the patient take a deep breath, and you're watching for symmetrical of your hands. Okay. So that was good. So both lungs are adequate, and we would percuss if we have any respiratory issues or you think possible pneumonia, hemothorax. You would want to percuss. You'll listen for dullness. So she doesn't seem like she has any respiratory issues, so we're not going to be doing that today. Next, we're going to listen to her heart. You're going to listen in all valves. First, we're going to start with her aortic, which is where you're going to hear your S2 the loudest. Move to the pulmonic. Move down to Erb's point. This may be a little hard with females with their bras. You just kind of have to go around it. Your tricuspid. And then over to your mitral. Sometimes it could be farther over to the side depending on weight. And this is where S1 is heard the loudest. Okay, so heart sounds are good. Just hear S1, S2. If you happen to hear an extra heart sound like S3 or S4, then you'll just want to tell the provider. Okay, next we're going to do hands. I'm going to have you kind of rotate your hands for me. Good. And then elbows. Kind of do range of motion. And go ahead and roll your shoulders forward and backwards for me. And backwards. Good. Now I'm going to assess her pulses. I'm going to assess the radial pulse first. Good. Brachial. And you want to do comparison on both sides. So brachial and radial pulses are equal to plus bilaterally. Now we're going to assess the Allen's test, where you occlude the radial and ulnar arteries, and you're going to have the patient pump thing in to get all of the blood out. You're going to have them stop, and you're going to unocclude one, and you're watching for blood return in one hand. You're going to do it again. Unocclude, and you're watching for blood return. And this is assessing circulation, make sure she has proper circulation. You'll do this in both hands. Like if they need an art line, this is the test that you would do to assess, make sure it's patent. Okay. So let's go to, I'm going to go ahead and have you lay back for me.
Okay.
And we're going to assess the abdomen. Kind of, for modesty issues, we're going to keep the shirt down. Normally you'd put your stethoscope on top of skin. We're going to assess all 4 quadrants for her bowel sounds. No skin looks good, no abnormalities. Okay, so positive or bowel sounds are positive in all 4 quads. Now we're just kind of push down, palpate, and ask, are you having any tenderness or pain?
No.
Okay, so she doesn't have any tenderness or pain on palpating. Now we're going to go ahead and we're going to compare her apical heart rate, and then we're going to palpate the carotid at the same time. Okay, and you're just kind of using that for comparison. They won't be exactly the same, but just as comparison. I'm going to go ahead and I'm going to have you close your eyes, and I'm going to have you differentiate between dullness and sharp. I'm going to do your face and your arms both at the same time.
Okay.
And then assess your legs. So have you close your eyes, and you tell me when you feel something dull or sharp.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull.
And we'll go ahead and move down to the legs just so you're doing the one thing at once.
Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, so she's able to tell the difference between sharp and dull objects. All over nails, you're going to make sure nails are well kept. You're going to check cap refill, which is less than 3 seconds. She has no edema. Skin is warm and dry and pink. You're also going to check for edema in the legs, but she has no edema noted. Skin is warm and pink. Assess all over color. Going to check bilaterally her popliteal pulses, which are right behind her knees. Okay, they're 2+ bilaterally. We're going to assess her posterior tibial. Sometimes it's a little hard to find. You just kind of have to push a little more pressure. Okay, and then her dorsalis pedis, which is right on top of the foot. So all pulses are positive times 2 bilaterally. I'm going to have you go ahead and rotate your feet for me. Okay, and bend one leg up at a time. And take your knee out to the side. Kind of check hip flexing. Do the same on this side. Okay. I'm going to have you pull your toes to your nose. Okay, and push against my hands. Okay, good. Okay, I'm done with that. Now I'm going to go ahead and say the things that I forgot to do. First, you're going to add